Merci beaucoup. That's the only French you're going to hear from me, I'm afraid. I'm not bilingual functionally. It truly is a pleasure to be here to talk to you all. I'm talking from the perspective of a general physician. So I have had a past background as a family doctor. I'm now a clinician in internal medicine. So I provide my comments from the perspective of the 35,000 primary care physicians and the 3,000 general internists in this country. My disclosure slide is here. I have no grants or research support. I serve on Speakers Bureau for a few of the major pharmaceutical companies, mostly in areas of metabolic syndrome, hypertension, and diabetes. The other disclosure I'd like to give is one that we're held to by the Canadian Medical Association Code of Ethics, and that is the recognition of a responsibility to give generally held opinions of the profession when interpreting scientific knowledge to the public, and when presenting an opinion that is contrary to the generally held opinion to so indicate. And most of what will follow is going to be a departure from what most of the physicians, I believe, would probably hold to. I have no disclosure of commercial support, and I really don't know what the commercial support for this meeting is. I imagine it's none, and I have no mitigating potential biases to report. I'd like to report on behalf of one of my patients. We refer to Lyme disease sufferers as patients because the word patient actually derives from the word to suffer. I think Dr. Gregson was quite eloquent last night when he talked about his experiences over 33 years with HIV patients. And it was quite palpable, the suffering as a physician that he expressed in dealing with those patients. I graduated from medical school 35 years ago, and I continue to suffer with my patients when they have setbacks and drawbacks. I'd like to report about this patient, TS. I have her permission to provide this case history. The picture that is depicted is the day that she got her tick bite in Calgary, Alberta, within the city limits. She's an athletic, healthy young mother. She did have an arthropod bite below her scapula on April 19th, 2015. She recognized the bite later in the day. After a few days, she developed a rash that was larger than a loonie, and it expanded over the course of several days. And as most young, healthy individuals, she did not seek medical attention. May 27th, about 5 weeks later, she was admitted to the hospital, our hospital in South Calgary, with persistent headache, dizziness, blurred vision. She was collapsing spontaneously and unexplainedly at home. She'd been in the hospital for 10 days before I got involved in her care and consultation. No diagnosis had been established at that time, and she had new symptoms that include generalized arthralgias, diplopia, paresthesias of her limbs, and her provincial screening for Lyme had been done and was negative. Her C6 test was reportedly negative, drawn 7 weeks after her incipient bite. The infectious diseases specialist at that time advised her that Lyme disease had been ruled out by serology, and this is the notation from the medical record. This is the two-tier testing that the Centers for Diseases Control recommend for testing for Lyme disease, and this is the methodology that's employed in the province of Alberta. The first test is a screening test such as the C6 immunoassay. If it is positive or equivocal, you go on to have a Western blot study, but if it is negative, you are advised to consider alternate diagnoses or to have the test repeated several weeks later if your signs and symptoms persist. We talk about two-tier testing in Canada, but the 2 tiers of two-tier testing are not done on 98% of people, because the ELISA is only going to be truly positive in those who have Lyme disease, and it's going to be falsely positive in those where the test has false positivity. So most patients don't have 2 tiers of the 2-tier testing. So our persistence of the terminology that we use 2-tier testing in Canada is actually a falsehood. Truly, most people have 1-tier testing. Could I have slide 36, please? I've warned the people at the back that we're going to try and bring slides up in a different fashion. And hopefully this works, and if it doesn't work, I'm sorry. So, that's the one. The C6 test is a patented test by Immunetics. This is their product monograph. If you look at the enlarged version of the product monograph, you'd be able to read all that is here. But the C6 test's intended use, as licensed in Canada, advises that negative results, either first or second step, should not be used to exclude Lyme disease. So we are using the C6 test as part of 2-tier testing explicitly against the licensed intended use of the product.